Hey guys, welcome back. Hope you guys are safe. In this video, we will be discussing about Amphotericin B. I'm sure that you might have heard this name recently because Amphotericin B is an antifungal medication which is used in the treatment of black fungus, white fungus and yellow fungus. Amphotericin B is an antifungal medication used for serious fungal infections and leishmaniasis. The fungal infections it is used to treat include aspergillosis, blastomycosis, candidiasis, and cryptococcosis. For certain infections, it is given with flucytosine. It is given by injection into a vein. The common side effects include a reaction with fever, chills, and headaches soon after the medication is given, as well as kidney problems. Allergic symptoms including anaphylaxis may occur. Other serious side effects include low blood potassium and inflammation of the heart. It appears to be relatively safe in pregnancy. There is a lipid formulation that has a lower risk of side effects. It is in the polyene class of medications and works in part by interfering with the cell membrane of the fungus. One of the main uses of amphotericin B is treating a wide range of systemic fungal infections. Due to its extensive side effects, it is often reserved for severe infections in critically ill or immunocompromised patients. It is considered first-line therapy for invasive mucormycosis infections, cryptococcal meningitis, and certain aspergillus and candidal infections. It has been a highly effective drug for over 50 years in large part because it has a low incidence of drug resistance in the pathogen it treated. This is because amphotericin B resistance requires sacrifices on the part of the pathogen that make it susceptible to the host environment and too weak to cause infection. Amphotericin B is used for life-threatening protozoan infections such as visceral leishmaniasis and primary amoebic meningoencephalitis. Amphotericin B alone is insoluble in normal saline at a pH of 7. Therefore, several formulations have been devised to improve its intravenous bioavailability. Lipid-based formulations of amphotericin B are no more effective than conventional formulations, although there is some evidence that lipid-based formulations may be better tolerated by patients and may have fewer side effects. An oral preparation exists but is not widely available. The amphibic nature of amphotericin B, along with its low solubility and permeability, has posed major hurdles for oral administration given its low availability. In the past, it had been used for fungal infections of the surface of the GI tract such as thrush, but has been replaced by other antifungals such as nystatin and fluconazole. Amphotericin B is well known for its severe and potentially lethal side effects. Very often, it causes a serious reaction soon after infusion, that is, within 1 to 3 hours, consisting of high fever, shaking chills, hypotension, anorexia, nausea, vomiting, headache, dyspnea, and tachypnea, drowsiness, and generalized weakness. The violent chills and fevers have caused the drug to be nicknamed shake and bake. This reaction sometimes subsides with later applications of the drug and may in part be due to histamine liberation. An increase in prostaglandin synthesis may also play a role. To decrease the likelihood and severity of the symptoms, initial doses should be low and increased slowly. Paracetamol, pethidine, diphenhydramine, and hydrocortisone have all been used to treat or prevent the syndrome, but the prophylactic use of these drugs is often limited by the patient's condition. Intravenously administered amphotericin B in therapeutic doses has also been associated with multiple organ damage. Kidney damage is a frequent reported side effect and can be severe and/or irreversible. Less kidney toxicity has been reported with liposomal formulations such as ambisome, and it have become preferred in patients with pre-existing renal injury. In addition, electrolyte imbalances such as hypokalemia and hypomagnesemia are also common. The mechanism of action of amphotericin B. Amphotericin B is fungistatic and fungicidal depending on the concentration obtained in body fluids and the susceptibility of the fungus. The drug acts by binding to sterols, that is ergosterol, in the cell membrane of the susceptible fungi. This creates a transmembrane channel and the resultant change in membrane permeability, allowing leakage of intracellular components. Ergosterol, the principal sterol in the fungal cytoplasmic membrane, is a target site of action of amphotericin B and the azoles. Amphotericin B, a polyene, binds irreversibly to ergosterol, resulting in disruption of membrane integrity and ultimately the cell death. Hope you guys like this video. Please do like, share and subscribe to Dr. Medicine. Thank you for watching. See you next video.